All right, guys, welcome back. This is Bio Bootcamp Live. I told you we had a couple of doctors, and here's another one of the doctors, Dr. Tracy Pierce, and she's going to show us something when it comes to cosmetics and injectables and the whole situation. She's going to give us that information. Dr. Tracy, are you there?
I am here, Nolen. How are you?
I'm doing well. I'm doing well. So exactly what are we going to be talking about today?
Maximizing your treatment results from the most common cosmetic injectable procedures.
Okay. All right.
Intro to neurotoxins, dermal fillers, and skincare.
Now, I've already read your bio, but just tell us a little bit about yourself.
Okay. I am a retired foot surgeon and a cosmetic nurse injector. You might ask, how did you go from a foot surgeon to a face injector? I was married to a cosmetic surgeon in Philadelphia, and he did breast implants and liposuction. I did the foot surgery and the cosmetic injectables as a nurse.
Got you.
Yep.
Because that is a crazy combination.
Yep. People
right?
often ask me. People always ask me that.
But if you have the knowledge of a surgeon and you're doing what a lot of people are doing, that they just get maybe a certificate, I would definitely trust my cosmetic anything in your hands before anyone else. So let's go ahead and get started. So what's the first thing that we need to realize?
The first thing you need to realize is that there's a saying that says 70% of your desired maximum benefits of a cosmetic injectable procedure, 70% of that is established with the actual procedure itself, whether it's a laser hair removal or injections. And the other 20 to 30% depends on the health of the skin or the condition of your skin, and that's directly related to your home care regime. So that's yeah.
Okay. So what type of tips do you give people when it comes to taking care of their skin? Is there some simple procedures or?
Well, there's just some basic information. There's an acronym GRASS, GRASS, and that kind of outlines what the specific ingredients that are necessary to get the most beneficial results. And
Okay. All right. So as we look at 70% being the procedure, the 20-30%, what else do you have as far as information?
Just a little booster that I give my patients, a little bonus when they're done with their treatment.
Okay. Is that booster what I think it is?
It is.
Okay. Well, we're going to save that for last. We're going to save that absolutely for last. So, that has been the secret sauce for a lot of people to maximize results on so many different levels.
I know.
In so many different industries, from weight loss to working out to nutrition. So that is great secret sauce. But as we talk about the different what all types of procedures are we talking about?
Well, the two most common ones are Botox and dermal fillers, but they're even though despite its popularity, people still confuse the reason for each. And so I was going to explain that a little bit.
Absolutely. I was just about to say, explain the difference.
Yeah. The difference between Botox and a dermal filler is Botox is a specific medication that has a specific function. It binds with the acetylcholine and prevents the message from the nerve to the muscle, so the muscle's temporarily paralyzed. So in essence, Botox is the thing that paralyzes the muscle, that moves the skin, that makes the wrinkle. That's what I say. Dermal fillers, on the other hand, are like skin dirt. You put it's just below the surface of the skin, and you fill trenches and valleys, increase the size of some areas like lips, or define your jawline or your cheeks. So those are the main two differences. Depending on the origin of the deficit, whether it's muscle related to muscle or it's just an act of filling in an area, it depends on which treatment you would choose.
Okay. All right. So if somebody got their head busted wide open, can you just fill that right on up with that?
There you go. Fill that with filler and you're good to go.
Not a problem. So do you do both of those things?
I do, yes. Yep.
Okay. All right. And you've been doing this for a while. So you started back in like 1990.
97. Yep.
97. All right. So you're definitely a veteran at it. I know you're on the East Coast. Yeah. Share with us some other advantages of what it is that you do, because I know it's is to look better a lot of times.
Yep.
But are there any health advantages as well?
There's been studies proven that people that are depressed, oftentimes they'll get Botox, and it dramatically increases their their view of life, though they have a better overall countenance, and they just feel better after they have the Botox treatments.
Okay. All right.
And then the skincare regime is really the most important. I know that the cosmetic injectables are nice, but the real thing that's the kicker is to have the home treatment regime. People last year, I think they spent $16.7 billion on non-invasive cosmetic procedures.
Wow.
Which is huge. So almost over 8 million people received treatments last year. So you would think that with the spending so much money to get 70% of your treatment, that everybody would want to know what the other 20 to 30% was, and they would actively do it. But that's kind of sometimes a problem.
Okay. All right. So if as you look at giving us the information, the differences in the Botox or the procedures, the differences in the procedures, and a lot of people know what those things are, right? So they go very specific from that standpoint. What else do you give them before we get to the secret sauce? I know you have those two things. And it really gives people an opportunity to figure out what they need to go get, right?
Yep.
If you just need Botox, now how long does Botox last?
Botox lasts on an average about 3 months, 3 to 4 months, they say. So it's a treatment that should be given 3 to 4 times a year. And then the collagen, the fillers range in length of treatment results, depending on which product you use. They all have different lengths of time. Some of them are 2 years, some of them are 6 months or 3 months. So, but the other thing is when you get Botox and filler together, your filler treatment seems to last longer because the muscle's not acting against it, causing divots in the skin. So that makes it appear that your treatment lasts longer.
Okay. Now you gave us some information the other week. A couple of weeks ago, you and I were talking about this Bio Bootcamp live, and you said younger people are using Botox from a preventative measure.
Yeah, it's seen a significant increase, like 72% increase in the patients below the age of 30 having treatments just for preventative purposes. They've taken a look at the treatment result from a Botox injection for someone in their 50s. If they have some creasing of the skin already, it's going to help it, but it's not going to make it be eliminated completely. So the best plan of action is to prevent those lines from happening in the first place. And you do that by, they call it tweakments. Tweakments is what the 30s are calling it. Tweakments, where you get a little tweak here, a little tweak there to prevent the formation of the lines and wrinkles like your parents would have, like your mother has, or your grandmother.
Got you.
Yep.
I had no idea people were starting that young.
And the funny thing is they're not afraid to talk about it. Like when I was coming up when I was in my 30s, 55 years ago, not really, it was taboo. Like nobody talked about it. Everyone denied it. Nobody admitted to having any type of treatment, and you could tell that people did. But now the 30s are like, they don't mind telling anybody. They'll be at the gym and somebody will say, "Oh, you have a little dirt on your face," and they'll say, "No, that's just my Botox treatment. I got a little bruise," and they'll tell anybody. So it's become much more popular and less of a taboo now.
Okay. All right. So anything else you want to talk about before we get into the secret sauce? What else you got?
The skincare specifically. The skincare treatment regime for at home is the ingredients necessary to get the best results is the acronym GRASS, and that would be a growth factor. The products they use, there's several different kinds of brands of product. They all have to be medical grade, preferably available only in a physician's office, and they have to contain the following things. It has to have a growth factor, which helps the collagen to produce under the skin. They have to have a Retin A. They have to have a antioxidant. It has to have, and it also has the specialty depending on if you have rosacea or something else, and sunscreen. Those are the key things that are necessary to have a good home care regime.
Okay. All right. And so now you've been with this special sauce
Yes.
for a while. each and every person that's been on here has talked about it with their background in their industry.
Mhm.
And you're just another doctor that we're adding to the group of these high echelon professionals that's doing what they're doing on the grander scale for most people. They have patients, they have clients, and you also endorse the gel. So
Yes.
tell us about the gel.
After the treatment, after the patient receives the treatment, if it's a filler, I need to massage the area. If it's Botox, just it feels better to have the area massaged. So I'll use a little bit of gel and I'll massage it into their face. It is a vascular area, so it's okay. And then I tell them if they want, this is a booster. It's going to make your Botox last longer, 25% longer. My patients that are on the gel tell me that they believe that their Botox treatments last 25% longer than without it. That's a great benefit. And it absorbs through the skin, so it gives the skin an overall better appearance. But I tell them if they want to continue these benefits at home, they can buy a bottle of gel and do it at home and incorporate it into their home care regime.
Now, because of the cellular generation that the gel brings to each and every person, it helps with the skin all the way around.
Yep.
Like my skin is much better. Reggie Rusk, ex-NFL player, was saying his skin was much better. We had Zarel Gibson from the Gibson Lupus Arc. Her skin was glowing,
I
right?
know.
It was almost like it was just crazy. It was glowing. So this is something that's definitely great for getting rid of wrinkles and everything as we grow younger.
That's right.
With this product. What are some of the other things that you've seen, because you've been on the gel for a while? What are some of the other advantages in your own personal testimonial of the gel?
The first thing I noticed was I had vivid dreams of good sleep, like everyone says. But within the first, probably I'd say 6 weeks, without changing my diet or exercise, I lost 12 pounds in my belly. And the most important thing to me was it just made me more even keeled. Like I didn't have highs and lows as often, and I was just more, I could deal with life. Like life sometimes sucks, but I could deal with it. It was okay. And those were the main benefits. And my joints feel considerably better.
Gotcha.
And my skin actually looks better since I've been on the gel.
Absolutely, absolutely. So I wanna thank you for coming out. I know you're coming in all the way from Massachusetts, correct?
Yep.
Absolutely. We have people from all over, from Arizona to South Carolina to Massachusetts. We have people all over. Everybody's a top professional. I want to thank you for being part of
You're welcome.
Justice.
I just like to add that if I have a website, Botox, and if you go to my website and fill out the consultation form on the first page, I will give you 50% off of your first treatment.
Oh, say the website again.
BIP, BIP. It's Bippity Boppity Botox is my name. So it's BIP, BOP, BOTOX.
BipBopBotox.com.
That's right. .com. Yep.
Right. That sounds like a game or something. Hey guys, let's play Bip Bop Botox. Right.
It's from the Disney movie, from Cinderella.
Right. Absolutely. Absolutely.
Yeah. So visit my website and fill out the consultation form and you'll get 50% off your first treatment.
Hey, I want to thank you for being part of Justice League as well.
Yep.
You're always out here with the team. We have our meetings. We're supporting each other. How do you feel about being a part of the team, like our team, like Justice League?
I was just telling somebody today what a great leader you are and how kind the team is to each other. I mean, sometimes they have competition even on teams, but this team is really gelling together and they just really want to support each other. And that's just great to see. It's what I need.
Absolutely. We really believe in not just having the same mindset for success, but the same heart set as well.
Yep, exactly.
So, hey, Dr. Tracy, I appreciate you so much. Hey, guys, this is great information. We're going to have some replays with some of this. So you want to write down the grass, you want to write down the difference between the fillers and the Botox. If you're thinking about some of these things, we're bringing it right to you right here. Absolutely no cost. And after this, we'll be right back. See you in a moment.
Thank you. Bye, Nolen.
Bye.